You can use the appearance of the RBCs to sometimes have forensic applications. For example, imagine a person is swimming in a swimming pool and he drowns in the swimming pool. Now, swimming pools are supposed to be filled with pure water with a little bit of chlorine in it. It's not too much. Now, when you drown, the water goes through your lungs, into your mouth and nose, down into your lungs, and then in your alveoli, they're in close contact with the blood vessels, and the water can easily just go and diffuse itself into the blood. So a lot of a lot of water mixes in the blood, and this is hypertonic. So guess how the cells are going to look if you find a dead body and a corpse, and you take a little bit of this blood and look under the microscope. It's going to look like it's hypertonic over there. However, if you were found a person who drowned in the ocean, you can take their blood cells and look, and guess what? The ocean has got a lot of salt, really large amount of salt compared to the isotonic fluid. So that is going to look like a crenated cell over there. So this is how these things appear. Okay, so this is tonicity. And we can use osmosis to treat certain conditions in our body. For example, there's a condition called glaucoma. In glaucoma, your eyes start to swell up because they're making a lot of aqueous humor, and that aqueous humor is supposed to drain out of the eyeball, but it's not going to drain out of the eyeball because either there's a blockage or there's way more production of aqueous humor than there is the drainage taking place. So what happens is we give an infusion into the blood of hypertonic solution. We usually use hypertonic mannitol. Let me just speak a little more about glaucoma. So what happens is this is your eye, right? This is your eye, and this is your lens, and this is your eye. I can draw bigger. I'll draw it much bigger. This is your cornea over here. This is your iris, and this is your lens suspended over here from the suspensory ligaments over here. There we go. Now you have the eyes over here, sclera. Okay, now look, what happens is there's this fluid called aqueous humor in front, and behind it it's got the vitreous humor, and here you got aqueous humor. That's your cornea and all that stuff. You could see it over there. So what happens is the aqueous humor is the fluid in the front part of your eye. It's what nourishes your cornea also with oxygen and nutrients, because there's no blood vessels on your cornea. It has to be transparent. So the fluid goes in here, and then what it does is from behind the iris, it goes in front and gets drained through something called the trabecular system. So this is the trabecular system. Now what happens is sometimes this gets sealed up. Okay, this fails to drain over there. So if I'm not wrong, it gets produced from the ciliary bodies over here, and then it's supposed to go out and drain into the trabecular system and just leave the eyeball. Now sometimes the production is too much, more than the drainage, so this accumulation of fluid can damage your eyes, because the pressure will eventually press on the lens, and it will press on the vitreous humor, which will press on the retina, causing permanent irreversible blindness. So pressure's going to affect your vision eventually. That's dangerous, very, very dangerous over there. So we don't want pressure on the retina, because that'll also cause pressure on the blood vessels that supply the retina and cause big problems eventually. So here we have the vitreous humor and the aqueous humor. Too much of production, or if these things get blocked, these trabecular systems, if they get blocked for whatever reason, fluid accumulates. So one treatment I can do is there are blood vessels that supply the eyeball, and if I give you an infusion through your arm, I'm not going all the way to the eye, of something called mannitol or glycerol, what's going to happen now? This mannitol or glycerol goes into your blood, and guess what it does? There's a lot more osmolality, or more particles over here in the blood than in the eyeball. So it's going to suck some water into the blood, and your fluid becomes less in the eye, and hence the pressure falls down. So you can save the person's vision during a glaucoma attack when it happens over there. This can happen sometimes in the evening times when your eyes are partially, in a dimly lit room, because that time your iris is really close to the lens and it tends to stick to the lens, causing a blockage. And that's an acute attack of glaucoma. It's a narrow angle acute attack of glaucoma. But you'll study about that later. Don't worry about that right now. Just know that we use mannitol or glycerol for glaucoma. We even use mannitol and glycerol to treat conditions like brain swelling. So sometimes your brain, which is encompassed in a skull, like a skull, the cranial cavity, we call this the calvera or the skull. It's the part of the skull that holds the brain. Well, what happens is, this is your brain, okay? It's a horrible diagram. I'm very sorry, but just use your imagination over here. We just need to get the concepts through. So what happens is, you have this calvera, and this calvera holds the brain. Well, the brain's not alone over there. This brain is floating in a fluid called your cerebrospinal fluid, CSF. So you've got CSF, you've got brain, and what else? You've got blood vessels over here that's supplying all of the nutrition for the brain. So you have brain, you have blood, and you have CSF. Now these are all fluid. You can consider them fluids in a way. And I want you to know that sometimes the brain swells up during injuries. So somebody gets a head injury, somebody gets hurt, somebody gets a stroke, somebody takes certain chemicals and poisons that can swell up the brain, like mercury poisoning or whatever. The point is, the brain is damaged and it starts to swell up. Okay, so it starts to swell up. Certain infections of the brain also can cause the brain to swell up. Now look, there's something called the Monro-Kelly doctrine. And Monro-Kelly doctrine is a simple common sense thing. It's that these are all fluids, the blood, the brain, and the CSF. They're technically water, okay? And what happens is, the water is not a compressible fluid. It's not something you can reduce and squeeze like air. You can take air in a plunger or balloon and kind of squeeze it a bit. And reduce the volume of the air, but you can't do that with liquids. So these fluids are non-compressible, so the volume of the blood, the brain, and the CSF, this is all constant. It is going to be the volume of the calvera. And if supposing one of these increases, let's say the brain starts to swell up, then this could be dangerous. The blood vessels have to squeeze or get squeezed, and the cerebrospinal fluid also can get squeezed. So if one increases, it does so at the expense of the others, and this is called Monro-Kelly doctrine. So your brain starts to swell for whatever reason, or let's say you rupture a vessel and in the brain, and so there's a lot of blood coming out, oozing and coming over here in the box. Now what's going to happen is going to press on the brain and the CSF, and the brain might herniate down the spinal cord through the foramen magnum. Foramen magnum. And that can cause death, because it will cause compression of very important brainstem structures. So these structures control your breathing, your heart, your blood pressure, and all that stuff. So if it gets pressed as it goes through that small foramen magnum, you can actually die. So brain injuries or head injuries are really dangerous and can kill you. Guess what we can do in certain situations? Well, if the brain is swelling and there's a blood vessel, I can give you some mannitol or glycerol that comes into the calvera. It sucks all the water inside and takes it away, and you piss out all the extra fluids. You pass it in the urine. So these are called diuretics actually. Mannitol and glycerol is given to reduce pressure in the eye and in the brain, and it works as a diuretic over there. The only thing is, these are carbohydrate molecules, so they can cause what do we say, sugar levels to rise. In some diabetics, you want to be careful with this, and it expands the volume of the blood vessels. Now, if a person has a weak heart, that expansion in the volume can strain the heart. So these patients with heart failure, they can actually suffer from that. Okay, so that is your Monro-Kelly doctrine. So these are some important concepts of osmolality over there. There is another formula I'd just like you to know, which is your how to calculate osmolality of blood. And we have another formula for that I'd like you to know. One of the simplest ways is just to multiply the concentration of sodium. So let's see, plasma osmolality. Sodium levels, sodium concentration into 2. This is the simplest and most crude method, and that tells you roughly how many, what's the rough osmolality of your blood, but that's not so accurate. So what's a better formula? You have something where you take 2 times the sodium and potassium concentration plus glucose weight in milligrams per deciliter divided by 18, and plus blood urea nitrogen. This is your creatine, urea and all that, the urea level divided by 2.8. Add this, and the tonicity usually should come to somewhere around 286 milliosmoles per kilogram. This is the most impressive number you can use, better than the number 300, if you say 286. Okay, and there is another way we can tell osmolality of the blood or the solution, which is by seeing how much the freezing point of that fluid has changed. Well, what I mean is, if you take some fluid, some pure water, it freezes at around 0 degrees Celsius usually. In reality, the freezing point of water is much lower than 0 degrees Celsius, but if you have a dust particle or a small little particulate matter in that water, it will start freezing at 0 degrees Celsius. So that is regarded as the freezing point of water for most lay people, including us. Now, what I want you to know is, if you add a little bit of salt, the freezing point changes a little more. So it won't freeze at 0 degrees. It will freeze at a lower temperature, and add more salt, it freezes at an even lower temperature. So the freezing point happens at a much lower temperature. So this becomes a problem if you want to freeze food. But you can tell the number of osmotically active particles by seeing the amount of freezing point depression. How much depression in freezing point is seen over there. So this is another thing. So that's how we actually calculate this 286 milliosmoles per kilogram much more accurately. It can be 282 to 286 milliosmoles per kilogram over there. So this is your freezing point depression. The change in the temperature will tell you how much of osmotically active particles are present in that solution. Another last topic which you should know about osmolality is, if you look, I told you that osmotic pressure is a colligative principle, meaning to say, if you add more molecules, the pressure, this is the osmotic pressure, and this is the number of moles of the molecule in the solution. As you increase the number of moles, the osmotic pressure will rise. This is true. Add one molecule, and you can calculate with Van 't Hoff's formula over here the amount of pressure which it will exert. We know that. We are not questioning that. But one more thing you should know. When you look at very big molecules like plasma proteins, it's not you won't get this linear relationship. The plasma proteins, when you put them in the solution, the osmotic pressure will actually be much higher. It follows a curve over here. it follows a curve. It is much higher. The pressure will be much higher than what you calculate through Van 't Hoff's law. This is one more point which you should remember. Plasma proteins are not so very colligative, but this is not emphasized in most books. So that means if you want to increase the osmotic pressure in compartment, like your blood vessels, when you have low blood pressure, severe low blood pressure, if we give some proteins instead of just sodium chloride solution, we will actually get a very marked increase in the blood pressure. That's where the colloids, we call them colloids, are used for increasing the blood pressure in such situations. So the colloids are better than the crystalloids, meaning the sodium chloride solution. You use the colloids with the plasma proteins and the big molecules. They actually exert a lot of osmotic pressure. They attract even more water than your crystalloids into the blood vessels, making the pressure more and restoring blood pressure or increasing the blood pressure and dealing with the shock in certain situations clinically. So this is your plasma proteins and how they are a little different from your this one typical crystalloid solutions. These are all very important topics, and there's so much more we can talk about osmosis, about how if you look at the tonicity, there's something called osmolar gap. Osmolar gap. So what is osmolar gap or osmolar gap? L-A-L, osmolar gap. So there is a difference between the calculated and measured osmolality. Now if you look at the calculation over here, this is the formula which I gave you over here. 2 times sodium plus potassium concentration plus glucose divided by 18 plus BUN divided by 2.8. This is your plasma osmolality over here. So this was the calculated osmolality. Okay, this is 2 times sodium plus potassium concentration plus glucose divided by 18, and the mass of glucose divided by 18, and the BUN divided by 2.8. So this is your osmolar. This is the calculated. If you want an even more accurate calculation, there's something called Zander's formula, but anyway, we're not doing that. Now, I'll just write that down. You can check this out. Zander's formula. This is the most accurate method to calculate your osmolality of blood. So calculated osmolality is, this is the basics formula which we have. Osmotic pressure is this. Now when you measure it using your freezing point depression technique, measured osmolality, freezing point depression, then here you are going to get your value which will be a little higher. There will be a slight increase. So there isn't a perfect match between calculated and measured osmolality. And can you guess why? Because we are not taking into account every single molecule and ion over there. For example, sometimes a person can drink ethanol, meaning alcohol, or they might even accidentally consume methanol. Methanol is a poison, actually, which the people in the factories mix with ethanol, so the workers don't drink it too much, and you can go blind and actually go into some acidosis and some major problems if you drink methanol. Anyway, so when somebody consumes alcohol in the form of ethanol or methanol, then the osmolality might also change. So that time the plasma osmolality is going to be a little different. It's going to be 2 times sodium plus glucose divided by 18 plus BUN divided by 2.8. Now we have to add ethanol in the formula, plus ethanol concentration divided by 3.7 plus methanol concentration divided by 18. So you see, now you get the different value. So this is how you can see that there are certain conditions which can change the osmolality of solution, messing with the values which you get. So this is osmolality, and there's much more I'd like to talk about, but we'll just focus on important concepts in the clinics. And these are the ones I could think of that would influence your clinical career over here. And I hope that we'll continue next class with active transport. Thank you.